So speaking of insurance and regulation, another thing that's received a lot of attention is the medical loss ratio and the 85%. Any thoughts on that role?
So I don't know. I guess I was good in arithmetic when I was in grade school. And the way I look at it is the more money you spend on medical services, the more money you get to keep, which seems like a perverse incentive to me. So I understand that this came out of a motivation to kind of restrict profits and even out of a lot of public demand for such a thing. But I do worry about the unintended consequence of the 85%.
Oh, there are also issues as well as what constitutes medical care, right? Especially if you think about social determinants.
That's a huge issue, and I think that there really is a need to sort through that, because especially as you're going with dually eligible and vulnerable populations, often the services that they need are not medical, and you don't want to go through a very expensive medical system to meet these other needs, and you also don't want to say, excuse me, that's not medical, so it goes on the wrong side of the ledger.
Right.
Well, that's addressed a little bit in the reg, talking about how coordination of care, for example, should be included in the so-called numerator. So it should be included as a medical service, which is interesting. I mean, I think we're going to potentially get into using this medical loss ratio as kind of a club on the plans to say this is what is and isn't, and it could get kind of ugly. And I agree with you. I think the primary problem is the elephant in the room is the perverse incentive. I mean, it's an incentive for plans to spend too much. One thing I do like as well in the reg, though, that I think can be helpful with that is the transparency provisions. I hope that those end up in the final rule. That really is requiring plans to be transparent about their network, who's in the network, et cetera, a lot more transparency of their quality, things like that. I think those are really going to be helpful just in at least as a break on the marketplace, if indeed the costs just are driven up and there's this odd debates about what's healthcare and what's not. Instead, we'll be looking at reality, which is this is what we're covering, and this is how you can navigate this market as a beneficiary.
Yeah, I'd like to talk about that for a moment, because we know transparency in the Medicare market and the commercial market. At least academic studies would suggest there hasn't been great success in terms of that information being used by the population at large. When we talk about a Medicaid population, that's a different population in terms of literacy, age, not to mention the fact that people are in and out of coverage and such. Any thoughts on how transparency plays out?
This is one of the problems, is that we expect too much of consumers in terms of active shopping. And, I mean, there's the Medicaid issue and the health literacy issue, but I mean, even if you're a sick person, your discretionary spending is long over, and you're kind of handled by the system, and you're on a conveyor belt. And so a lot of the really high-cost patients, they're really not in a position to be using this information. So there's, there may be other shaming techniques that others can use and so on. And I believe in transparency. I just don't think we should get too complacent, thinking if you just put the information out there, that solves the problem.
Well, and the highest cost patients are those with substance use and mental health disorders, and they're really not going to be in a position to consume that information and make the best use of it.
Well, I don't know about that. I mean, they have families, and often the families are in the position of making those kinds of decisions. And I do think that people do need information to at least know in the network is a good hospital or a bad one, or a good,
definitely.
That some people will make a decision based on that. And that can have a big impact on the market, even a small number of more active consumers. What we've seen in the private sector is, although traditionally consumers have not used quality information that much, even when it's available, it's not always available, but when it is, they haven't used it as much as we perhaps would like. What has changed that, though, is price transparency. So now that more in the private sector, more people have high deductible plans, and they're needing to pay the whole bill out of their pocket. So they're very interested in the price of care, and that has brought them to the table to also look at quality, because price is not enough information. Once you know how much it is, you want to know what you get.
Although I guess I'm not sure how much that's going to be relevant or helpful in the Medicaid population.
Right.
Because their cost exposure is effectively zero.
Right.
But I think that it does get back to, we were sort of saying earlier about, managed care needs to be very thoughtfully done, needs to be overseen carefully. But I would make an important point here, which is on the potential benefit of it. Because managed care is, there's a lot of different ways to do it, but one of the best ways to describe it is almost by what it isn't. And what it isn't is unmanaged care. And that's been the basis of the US healthcare system and Medicaid and Medicare for a very long time. Fee-for-service requires the individual, low income, high income, sick, whatever, to go out and to figure out, what the networks are, what the services are. Fee-for-service, we have this old joke, fee-for-service, FFS, really should stand for fend for self, because that's what we're requiring of people who are the oldest, the sickest, the frailest, co-occurring substance abuse and mental health disorders. They have to go and navigate a system and try to figure out transparency. That's not the way to do it.
This is a really crucial point.
Well, this is the point about
managed
special
care done
population
right
choice that we
really
can
is.
serve to bring the services that the person needs to them.
So let's
come
come
back
back
to
to
done
that.
in a patient-centered way.
Sure,
Yeah.
absolutely,
Yeah.
No,
absolutely.
I know
Well,
we
that's the
wanted
crux
to.
of it. I mean, that's a theoretical idea, but I'm not sure that if you did a poll of Medicaid beneficiaries, that they would say that managed care is very managed from their point of view. So in reality, I mean,
I think there are different models of managed care out there, and what's done for commercial populations and for the TANF population in Medicaid is quite different from what they need, these vulnerable populations who may be homebound, who are seeing many different providers. Creating a system around them is the best thing you can do for them. Of course, you don't want to lock them into a system that doesn't meet their needs. But this is very different. It's a real ground game, taking care of these people, and partnerships with local providers and so forth. So I think the measurement logic is quite different. We're working on a lot of this right now, and it feels really urgent.
Just to add one thing on transparency, even if transparent prices and quality doesn't have an impact on, doesn't change how people get their care, what they choose, doesn't affect costs and outcomes. I still think it should be provided as a moral issue.
I agree.
And not just to the enrollees, but to taxpayers.
Right.
It's a public program. We should know a lot more about how it's working, what the quality is, where it's high, where it's low, and how much it costs.
So I just want to make one other point about transparency. Look at the STAR program with MA plans, with Medicare Advantage plans. What they did was take quality measures, bundle them, make stars, not perfect, working, but they also, if you're a 5 or 4.5 star plan, you get extra money to put into benefits so that the people that are shopping, they have the financial incentive, and that is very smart. So there are ways to use quality information in a way that drives people towards higher quality providers, and I think that's a great example of that.